Welcome back to What Your Blood Test Really Means. I'm Charmaine Shepherd, and today we're going to be talking about hs-CRP, the inflammation marker that predicts your future health. So if you've ever been told your blood tests are normal, but you still don't feel well, one of the most overlooked blood markers is hs-CRP, or high sensitivity C-reactive protein. Most people think it's just an inflammation test but in functional medicine, we see it as something much bigger because chronic inflammation sits at the center of almost every modern disease. So hs-CRP is a protein made by your liver in response to inflammation. Think of it as your body's smoke alarm. If there's a fire somewhere in the body, even a very small one, hs-CRP starts to rise. So unlike a standard CRP test, which detects obvious infections or major inflammation, hs-CRP is sensitive enough to detect tiny amounts of inflammation that quietly build over many years, long before symptoms appear and long before disease develops. So most laboratories consider anything below about 5 milligrams per liter to be normal. So if yours is 3, 2, or even 4, you'll probably be told everything looks fine. But this is where functional medicine takes a very different view. Ideally, I like to see hs-CRP below 0.4 milligram per liter, certainly under 1 milligram per liter. And this is because study after study has shown that cardiovascular risk begins increasing long before you reach the laboratory cutoff. So an hs-CRP of 3 may be normal, but it represents approximately 3 times more inflammation than somebody sitting at a level of 1, and inflammation accumulates. Inflammation doesn't just affect one part of the body, it affects everything. So higher hs-CRP has been associated with heart disease, stroke, Alzheimer's disease, type 2 diabetes, fatty liver disease, autoimmune disease, depression, some cancers, and faster biological aging. Inflammation accelerates wear and tear throughout the body. It's like driving your car with the engine running too hot every single day. Eventually, something breaks. So what causes it? This is where the detective work begins. hs-CRP doesn't tell us where the inflammation is. It simply tells us that it exists. So the next question becomes, why? So common causes include poor blood sugar control, visceral fat, poor sleep, stress, smoking, alcohol use, chronic infections, hidden dental disease is a big one, gut inflammation, food sensitivities, environmental toxins, autoimmune disease. So even overtraining can temporarily raise hs-CRP. The number itself isn't the diagnosis, it's the clue. One of the biggest drivers I see in clinic is the gut. If bacteria, yeast, or parasites are disrupting the intestinal lining, inflammatory molecules can leak into the bloodstream. Your immune system will react. The hs-CRP will rise. And sometimes patients spend years chasing joint pain, fatigue, brain fog, when the real source of inflammation is sitting inside the digestive tract. This marker became famous after researchers discovered something remarkable. Two people can have exactly the same cholesterol, but the one with a higher hs-CRP has a much greater risk of having a heart attack. And that's because heart disease isn't simply about cholesterol. It's about inflamed arteries. Think of cholesterol as the bricks, and inflammation is the builder deciding where those bricks get laid. Without inflammation, plaque formation becomes much less likely. Inflammation doesn't stay in the body, it affects the brain too. So higher hs-CRP has also been linked with brain fog, poor concentration, depression, cognitive decline, Alzheimer's disease. Your brain is incredibly sensitive to inflammation, which is why lowering hs-CRP often improves far more than physical symptoms. So, what are the things that can lower hs-CRP? The goal isn't just simply to suppress inflammation, it's to remove what's causing it. So, it might include improving your blood sugar control, reducing visceral fat, testing for gut infections or oral infections, healing the gut lining, optimizing things like your omega-3 levels, improving sleep, managing stress, correcting vitamin D deficiencies, treating chronic infections, increasing daily movement, and eating an anti-inflammatory Mediterranean style diet, rich in colorful plants, extra virgin olive oil, nuts, seeds, and oily fish. The number will come down because you've addressed the cause. There is one important caveat. hs-CRP can temporarily rise if you've recently had a cold or flu, COVID, dental work, surgery, vaccinations, or a hard endurance physical event, or even an injury. So I always interpret the results in context. If you've been ill the week that we drew the blood, I may simply repeat the test once you've recovered. hs-CRP is one of the best windows into what's happening beneath the surface because it's not just about inflammation. It's about your future risk. A normal result doesn't always mean an optimal result. And if your hs-CRP is elevated, don't just ask, how do I lower it? Ask what is causing the inflammation in the first place, because that is where the real answers lie.